Welcome to PDR. Most likely you are going to treat with us because of issues related to neck and back pain. You may have had other therapies in the past. Since 1994, we have specialized in the treatment of patients with neck and back pain. This video presents an introduction to our program to help you better understand how and why our program differs from other therapies. Each patient receives complete hands-on evaluations from a doctor and physical therapist. Patients also meet with an occupational therapist to evaluate capabilities, assess body mechanics, and set goals related to daily activities. Each evaluation is geared toward establishing a plan best suited to meet your needs and to improve your abilities in your daily life. These evaluations typically occur on the first 2 to 3 visits. Most treatment plans include hour-long visits 2 times per week. Each visit is spent one-on-one with a licensed therapist or therapy assistant. Most patients see a team of therapists during the course of a 10 to 12-week program. We believe that being seen by multiple therapists helps us better plan and problem solve, which ultimately results in happier, more satisfied patients with better results. Each clinic has approximately 4 or 5 providers on site. Therapists meet regularly for rounds to discuss the patient's progress and plans. This allows us to use the experience and knowledge of multiple therapists to be the most effective in meeting patient needs. A typical visit will include instruction in stretches, use of the medic strengthening equipment, and education in body mechanics or instruction in home exercise. We encourage all our patients to also complete regular cardiovascular exercise on the stationary bike or treadmill. You will start at a level that is appropriate for your health and conditioning.
There are 4 different Medix machines: lumbar extension, rotary torso, cervical extension, and cervical rotation. Your referring doctor and our physicians will decide which Medix machines are appropriate for you based on your physical evaluation. We have established protocols for those patients who have undergone surgery for their neck or back. We have accelerated protocols for individuals having fewer difficulties, and special protocols for people who have spinal implants. We also have specialized protocols for women who are pregnant, individuals whose injuries are more recent or acute, individuals with fibromyalgia, spondylolisthesis, or disc herniations and bulges. You can be assured and confident that you will be treated as an individual with your own special needs and concerns taken into consideration. Some patients will undergo testing in the Medix machines. This allows us to compare current patient strength and range of motion with established norms. Others will forego testing and start with gentle exercise until a point when his or her body would be able to tolerate the testing. At all times, the patient is moving the machine and not vice versa. Each person will be secured in the machine to ensure safety and proper isolation of these muscles. We want to test and exercise the appropriate muscles without other muscles compensating. Pain-free range of motion will be set on each visit with the patient in charge of how far he or she moves. Our goal is that the motion becomes greater on subsequent visits. The amount of resistance on the machines is adjusted by the therapist with the goal of the patient being able to do 15 to 20 repetitions each session. The initial resistance is based on test results and many years of experience with the machines. Patients are instructed to stop pushing at any time if they have pain or strain. Retesting after every 4 weeks of exercise and dynamic resistance goals let us know when someone is making progress or has reached his or her full potential in the Medix machines.
It is essential that patients are compliant with their established plan in order to get the most out of the program. Coming to therapy 2 times a week allows the body to gain the most benefit. Additionally, it is extremely important that each patient be compliant with his or her individual home exercise program. It is normal to be sore from testing and exercise. Muscles that are strengthening will ache and feel fatigued. It is not okay to feel pain while you're in the Medix machine. If you do, tell the therapist and adjustments will be made to positioning, range of motion, or resistance. Our doctors will adjust the treatment plan accordingly in rare occasions that pain prevents further use of the Medix machines.
Our typical program is between 8 and 12 weeks. Patients should schedule follow-ups with our PDR doctors after every 4 weeks of therapy. The therapists and therapy assistants are all certified in the use of Medix equipment and have undergone extensive training to ensure patient safety. All are also trained in hands-on manual therapy techniques, use of traction, ultrasound, and electrical stimulation. The doctor will write orders to best suit your needs. Typically, these other techniques are used only when pain is a limiting factor in exercise progression. Individuals will be exercising as well as spending time learning about posture, body mechanics, and lifting each session. Ultimately, we want the patient to have the skills and knowledge to continue to improve and prevent further problems once discharged from therapy. Maintaining strength and flexibility is dependent on patient follow-through with the home program. You should expect to do some stretches daily. You will also be taught to do home strengthening 2 to 3 times per week and cardiovascular exercise at least 3 times per week. Do not work through increasing pain.
Most patients who go through our program experience increase in motion, decrease in pain, increase in strength, and gain a wealth of information to help prevent further neck and back injury. We hope to help you become more independent in your daily activities and to resume those activities you've had to avoid. Feel free to communicate your questions and concerns with your therapist and doctor.